Sam Abraham, Director Abraham Sympathy and Gynec Center. Very often patients ask us, Doctor, it has been found that there is a cyst in my ovary. Is it problematic? What should I do? I am too much worried. Like that, we get questions like that. Now you know that ovaries, there are two ovaries on either side of the uterus as we see in the diagram. Now every month from the ovary, one follicle will rupture to release egg. This is called ovulation. Sometimes what can happen is that they may not be ovulating and these follicles continue to grow, and this is what we call as the follicular cyst. And every month the follicle ruptures to release egg. This is called corpus luteum. And sometimes what can happen is that there can be bleeding into this corpus luteum, and this is called corpus lutein cyst. So these are all physiological cysts. That means this is an alteration of the function of the ovary. That is why this happens. Sometimes there can be other cysts also, like an endometriotic cyst. Endometriotic cyst is you have the uterus lining inside the ovary. So whenever the patient is just like bleeding from the uterus, they may be bleeding into the ovaries and can have this cyst formation. This is called endometriotic cyst. Sometimes they can have tooth and hair-like structures in the ovary, and this is called dermoid cyst. And what we have to understand is that most of the cysts may not be cancerous, but sometimes there can be cancerous element in the cyst. So whenever you are found with a cyst in the ovary, what you have to understand is that is the cyst problematic? Is it having cancerous element, or is it just an alteration of the physiological function? You have to go into the details of the cyst. Never ever ignore a cyst, because this cyst can undergo certain complications. It can undergo twisting. There can be bleeding into the cyst. Or once there is torsion, once it twists, what will happen? The blood flow gets cut off. It twists my organ, what will happen? Blood flow will be cut off. And then infection can set in. And it can cause infection of the abdominal organs. This can be called peritonitis. Or if you miss a malignant area there, it can spread to other parts of the body. So we have to understand that the cyst causes can be many. It can be benign, it can be cancerous. Benign means it's not problematic. It is not cancerous. Even though it is not cancerous, sometimes they can have bleeding. I told you, infection can come. It can undergo twisting. Other complications can come. So whenever you are found with a cyst in the ovary, what you have to understand is that is the cyst, what is the cause of the cyst? Is it a part of the abnormality in the development of the follicle, or is it a cancerous element? All these things has to be looked upon. How can you know that? You can know it by ultrasound. You can know it by studying the blood flow to the ovary. You can study it by magnetic resonance imaging, MRI. So once you are found with a cyst in the ovary, find out the cause, and if it is to be operated, operate it with the laparoscopy. The advantage of laparoscopy is that you are able to see the structure very clearly in the scene. Previously, years back, when we are talking about the advantages of laparoscopy, we used to tell that the advantage of laparoscopy is that they don't need rest and they can return to work normally. But now what we have found is that the advantage is that you are able to see the vessels very clearly on the scene, and so you are able to do the surgery more specifically and more clearly, giving a better outcome to the patient. So my message is, whenever there is a cyst, you are found with a cyst in the ovary, never ever ignore the cyst. Find out the cause of the cyst. Find whether it is physiological or malignant, and then it has to be managed accordingly. It has to be in detail studied with ultrasound, Doppler and MRI. And once you are found with a cyst, be very clear about the management, operate it with a laparoscopy only.